you or your loved one is impacted by diabetes and have questions, the Barbados Diabetes Foundation has the answers.
It's always easier to reverse diabetes, certainly control it properly and avoid complications if you at least know that you have it.
So it's just again to re-emphasize the importance of good diabetic care. And diabetic care involves really almost every part of the body. So it's your feet, your heart. But again, we're coming back to what our main focus is at this time is the eye care.
The Maria Holder Diabetes Center, located in Warren, St. Michael, is your source of diabetic care. You can reach them by calling 243-EYES, 243-3937 for more information.
What station is this again? It's VOB 92.9 FM. And what happening now again? The same thing that happens every Saturday morning at 9 o'clock. It's time for 15 of the healthiest minutes you will ever hear on your radio with the compliments of the Barbados Diabetic Eye Screening Program, the Maria Holder Diabetes Center, and the Barbados Community Foundation. Good morning to Larry and all of Larry friends who not only love cricket but love listening to this show, which highlights the services of the Maria Holder Diabetes Center. Two of our featured segments today you are not going to want to miss. One of them will be how when you are exercising, you don't have to be drinking all those expensive energy drinks and things. Why it is better for you to drink water. Also a segment about everything that you ever wanted to know about your eyes but were afraid to ask. You're going to hear about cataracts, you're going to hear about glaucoma, everything. So if you are planning to leave home, cancel that. Make sure and listen, especially if you are diabetic or pre-diabetic. The year now starts and it is time for you to make a visit to the Maria Holder Diabetes Center, located in Warren, St. Michael behind Eunice Gibson Polyclinic. If you find that your feet has been swelled up and you think you might got bad circulation, start 2024 right by making an appointment for a vascular screening. The telephone number will be coming up soon. A new year, and if you have made this resolution, I would like to lose some of this weight that I put on for Christmas.
Well, you need to make an appointment to see nutritionist Victoria Cox so she can design a personalized meal plan that is especially dedicated to you. You can also see a podiatrist for checking your feet because you know once you're diabetic, you need to keep your feet healthy, or schedule a consultation with diabetes specialist doctors like Dr. Diane Braffett and specialist nurses like Nurse Tracy. Alright, you ready for the number? I am going to give it to you now. The number to call to make that appointment is 243-3937. That number again? 243-3937. That number also allows you to have your eyes checked for diabetic retinopathy, which leads us to our first segment of the morning. Everything you ever wanted to know about your eyes, but you were afraid to ask, you're going to hear right now. Presented by Dr. Charles Pierce, clinical lead of the Barbados Diabetic Eye Screening Program. Take a listen to this and you'll be able to see some things better.
Important to recognize that many of us are actually blessed to have vision or good vision, but then there are other people in the world who are struggling with reduced vision, and we have to also do our best to maintain the vision that we have, such as making sure that we're controlling other factors such as our diabetes, glaucoma, all of those factors that can make a difference to our vision long term.
So you mentioned diabetes. What are the specific challenges that diabetics would have as it relates to their sight?
So in the early stages, people would probably not notice any significant difference in their vision. However, as the diabetes progresses and remains uncontrolled, then they might have specific challenges, for instance, in their central vision, or they might actually start to notice floaters in their vision if there's bleeding. And then at the very end stages, there can be scarring at the back of the eye, or you can have something called a retinal detachment. All of these can cause significant loss of vision. And these are all various stages of diabetic retinopathy, from the very early mild stage to the advanced stage where you have abnormal blood vessels growing or leakage at the back of the eye.
So how often should a diabetic check for diabetic retinopathy?
So this all depends on the stage of the diabetic retinopathy that you're diagnosed have no diabetic retinopathy or very mild diabetic eye changes, then you can be seen once a year. However, in the more advanced stages, then it will require more frequent monitoring.
And how is it checked?
So the check could either be an eye healthcare professional or your doctor having a look at the back of the eye with a special instrument, or you could have a digital screen where a photograph is taken at the back of the eye, such as at the Diabetic Eye Screening Program, and then this is analyzed to see if there are any signs of diabetic retinopathy.
So can diabetic retinopathy be treated or can it be prevented?
The main way that it can be prevented is good control of your diabetes overall. And if there are changes at the back of the eye that require treatment, there are several very good treatments available.
So what is cataract, and is it more common in diabetic patients?
So cataract is a clouding of the lens in the eye, and it tends to happen, well, everyone will develop cataract at some point, but whether you need to operate it very much depends on your own visual requirement. And unfortunately, it does tend to occur at an earlier age and progress quicker in diabetic patients.
What is glaucoma?
Glaucoma is a change in the nerve at the back of the eye, which causes you to lose your visual field. So you're not seeing all parts of your field of vision. And it's usually, but not always, related to an increase in the pressure in the eye.
And how can I check for glaucoma?
The best way to check for glaucoma is for an eye healthcare professional to check the pressure as well as examine the nerve at the back of your eye to see if there are any of these characteristic changes of glaucoma.
And how is it treated?
So treatment depends on the stage of glaucoma. In most cases, it can be treated initially with either drops or a laser procedure. However, in the more advanced stages, this will require surgery to control the pressure in the eye.
Did you know nearly 1 in 5 adults in Barbados have diabetes? Did you know diabetes is one of the leading causes of vision loss in the world? Regular eye screening can save your eyes. Contact the Barbados Diabetic Eye Screening Program today at 243-3937 to find out how you get your simple digital eye screening done for just $100. But members get 10% off. The Barbados Diabetic Eye Screening Program. Saving eyes, saving lives.
As we continue on the Maria Holder Diabetes Center radio show, right about now, it's time for our water break.
Drink more water.
That was good. I hope you out there listening to VOB drinking more water too, you know. Remember, the Barbados Diabetes Foundation invites you in 2024 to choose water and stay cool and get all the healthy benefits of drinking water. And one of those benefits can be derived by drinking water while you are exercising. You want to hear more? Let's bring in General Manager of the Diabetes Foundation, Miss Marsha White. Good morning, Marsha.
Good morning. Today I'm talking about water and why water is always the better choice. When you're doing exercise, normal kind of exercise program, you do not need to be drinking sports drinks. Sports drinks are heavily laden with sugar and artificial ingredients, calories. They can actually counteract the exercise that you're doing. So yes, sports drinks may have a place when you're doing something that's more intense, a long distance event like a marathon or a triathlon, especially if you're doing it in a hot climate. That would be the only time I would recommend that you drink a sports drink because they do have electrolytes in it. But under normal circumstances, water is always the better choice. It will be a natural hydrator. It's pure. It does not affect your teeth. It does not have sugar in it that will potentially offset your nutritional requirements. It doesn't have empty calories in it because those calories in sports drinks can add up quickly, potentially hindering any kind of weight loss or weight management efforts that you have. And as I said, electrolytes are not always necessary. Persons engaging in regular moderate exercise do not need electrolyte replacement. You can get all of those minerals from your regular balanced diet without all of the added sugars. So for most of us, water is always the better choice for everyday hydration. Remember, it's accessible, calorie-free, and will not harm your dental health. So pick water.
Thank you, GM Marsha White. I hope you all hear what Marsha said. Tell him again, Marsha.
So pick water.
Pick water. That's the better, healthier choice for you. Remember, you can get more tips like this by liking the Barbados Diabetes Foundation social media on Facebook or Instagram. It's time now for our song of the day. And our song today is a song about water. A song that will make you get up and dance and drink more water. This is Ira George with The People Want Water. Compliments, the Maria Holder Diabetes Center.
What the people want? Water. Carnival, they jumping in the sun. Ash when they are balling for someone. They want me to cool at temperature.
Drink more water.
People want water. The people want water. Them girls they want the water. Hey, raise your hand if you want some water. Raise your hand if you want some water. Raise your hand, jump up in the water. People want water. The people want water. The people want water. Them girls they want.
Pick water.
Set it out on fire. Some may go on fire. Set it out on fire. The people want water. The people want water. The people want water. The people want water. What the people want? Water. What the people want? Water. Plain massive peace like Savannah. The sun shining hotter than pepper. They want me to cool that temperature.
Pick water.
The people want water. The people want water. The people want water. Them girls they want the water. Hey, raise your hand if you want some water. Raise your hand if you want some water. Raise your hand, jump up in the water. People want water. The people want water. The people want water. Them girls they want the water. Shape, the water flowing.
Another service which is available at the Maria Holder Diabetes Center is vascular or ABI screening.
Who should get this screening, boy?
Persons living with diabetes, persons who experience pain while they are resting, or a burning pain sensation in their legs or toes. If you have what is called bad circulation, if that sounds like you might need this vascular or ABI screening test. Call 243-3937 to get more information and to make an appointment. Another 2 indicators you might need this screening is erectile dysfunction or varicose veins. Let's hear what vascular spokesman Donald Clark had to say about this.
I should indicate that this is not a male-only condition because of erectile dysfunction, but female condition as well. Ladies with varicose veins have their condition to have this ailment. So I would want to say that women should also have this test done. Again, peripheral artery and peripheral vascular, which is different because arteries are arteries and veins are veins. But varicose veins is a telltale sign that there's a problem with peripheral vascular disease. In men, of course, it's erectile dysfunction. That is major. That's how you tell that there's a problem. That's how men would normally tell that there's something going on. There's no blood flow, or there's, I should say, reduced blood flow to the penis, of course. But in women, varicose veins is a telltale sign that there's also a problem. Peripheral artery disease, it's a simple test. It's called an ABI test, and I can't stress enough the importance of getting this test done.
The Maria Holder Diabetes Center, located in Warren St. Michael, with their diabetic eye screening program, offers a standard of service that equals or surpasses any you might receive internationally. So if you're a diabetic or pre-diabetic and listening to your radio right now, you need to make an appointment and get your eyes screened by calling 243-3937 to make that appointment. In addition, there's now a new vascular service that is the centerpiece of a national campaign that will highlight the discovery of early circulatory problems in the limbs and extremities of at-risk persons. So if you are having vascular or circulation problems, call and make an appointment at 417-5980 or 243-3937. The last 15 minutes you heard on VOB was brought to you with the compliments of the Barbados Diabetic Eye Screening Program in partnership with the Barbados Community Foundation and the Maria Holder Diabetes Center. Until next time, take care of your eyes.
A brand new service which we can be proud of is now available at the Maria Holder Diabetes Center. vascular or ABI screening. Who should get a vascular screening? Persons living with diabetes or persons who experience pain or burning sensation in their legs or toes, especially while they are resting. This is normally referred to as bad circulation. Book your vascular or ABI screening test today.